This is Puan Latifah. She was diagnosed with major depressive disorder. After she has MDD, she prefers to stay at home and just lay on the bed, feels tired and lost appetite to eat. She couldn't sleep and thinks everything that she does is pointless. From Puan Latifah's story, how can we assess her severity in mental illness? We can use threshold assessment grid tag. This is threshold assessment grid tag. It was published between 1996 to 1998. TAG is a standardized assessment in routine clinical practice to assess the severity of an individual's mental health problems. It is a brief and quickly completed assessment by ticking boxes in 7 domains. It only takes about 10 to 15 minutes to complete. TAG was developed by Mike Slade and other colleagues at Institute of Psychiatry, Psychology and Neuroscience, King's College London. It is a clinician-rated assessment and the purpose is to rate the severity of individuals' mental illness and used to refer the client to a specialist mental health team. The target population is it can be used for a variety of mental health problems who need mental health services, and the contraindication is people with poor insight and low cognitive function. Component being assessed is divided into 3 areas and has 7 domains: intentional self-harm, unintentional self-harm, risk from others, risk to others, survival, psychological and social needs or disabilities. It only takes about 3 to 4 minutes to administer. But how to administer? In TAG, there are score sheet form and checklist of factors, and the therapist need to interview the patient and use clinical judgment to rate patient's answer during the interview. Step 1. In score sheet form, require one tick to indicate the level of severity in each of the 7 domains, and it is completed by making 7 ticks. The scale is 9, mild, moderate, severe and very severe. For domain number 2, 3, 6 and 7 is from 9 to severe, while domain number 1, 4 and 5 from 9 to very severe. Step 2. In the checklist of factor form, interview checklist of factor form for all the 7 domains, but is for optional use to identify concern, but the TAG score is made on the score sheet. Sum the score for each domain to get the TAG score according to this, and then the TAG score is ranged from 0 to 24 with maximum 4 severe and 3 very severe. For interpretation, at least 1 severe or very severe domain are suitable to refer to psychiatrists. The best cutoff is TAG score 5 or more or at least 2 moderate domain. For referral below 2 moderate domain, they need to provide referral letter to state why psychiatric services is required. Psychometric properties. TAG has moderate to strong correlation for concurrent validity and very strong correlation for construct validity. TAG has good test-retest reliability and moderate correlation between different raters for inter-rater reliability. The strength for TAG is it is very easy to complete, require only 7 ticks on the score sheet, it saves time and energy and rate by the therapist or staff. It has good construct and concurrent validity and may be used to assess suitability for psychosocial rehabilitation. For limitation, it is less sensitive to detect suitability for referral, and no evidence indicates to what extent the severity of mental health is suitable for psychosocial rehabilitation, and the inter-rater reliability range poor to good in different domains. Threshold assessment grid tag is suitable to be used in Malaysian population because the items are relevant. Now, let's see the video demonstration on how we conduct this assessment to Puan Latifah. Assalamualaikum and good morning. My name is Ain Hazika. I'll be your therapist in charge for today. Firstly, I want to ask if you prefer me to speak in English or Malay? Malay. Okay, baiklah. So, saya akan teruskan untuk cakap dalam bahasa Melayu lah. Puan Latifah hari ni sihat?
Alhamdulillah sihat.
Sihat. Jadi datang sini dengan siapa?
Anak.
Dengan Anha. Okey. Hari ni saya nak tanya beberapa soalan kepada Puan. Saya akan gunakan threshold assessment grid tag untuk tahu sejauh mana keseriusan Puan dalam masalah depression ataupun depresi. Okey. Pertama sekali saya mahu tahu berkaitan dengan keselamatan diri Puan. Puan ada tak melakukan cubaan bunuh diri?
Tak ada.
Tak ada. Tak ada ya. Cubaan merancang ataupun hasrat Rasa nak bunuh diri tu aja ke?
Tak ada dah.
Tak ada. Rasa macam rasa tak bersemangat ataupun rasa dah tak ada harapan untuk hidup. Putus asa.
Ada
Putus asa
juga sesekali.
sekali ya. Sekarang saya akan bergerak ke domain yang kedua, iaitu unintentional self-harm. Adakah sampai depression tu sampai berhari-hari, bisa sehari tu tak mandi, tak nak makan?
Tak adalah, mandi tu mandi. Kadang makan tu memang kadang-kadang macam tertekan sangat, memang tak mau makan, tak ada selera makan.
Ada makan. Kalau tak makan tu berapa lama?
Tengoklah, kadang dalam setengah hari ke, macam tu.
Okey. This is the result after the previous interview. Fill in the number of text box. And calculate the text score by sum it up. 4 plus 6 equal to 10. Score 10 indicates the client is suitable to refer to psychiatrist.